Hi, I'm Dr. Tammy Penhollow. I'm a regenerative pain management physician. I went to college at Willamette University in Salem, Oregon, where I majored in biology and minored in chemistry and psychology. After that, I attended medical school at the Kirksville College of Osteopathic Medicine for 4 years, and my rotations, clinical rotations in the hospitals and clinics, were actually right here in Phoenix, so I'm so happy to be back. After that, I did residency, specializing in anesthesiology at the Walter Reed Army Medical Center in Washington, D.C., and the National Naval Medical Center in Bethesda, Maryland. That was 4 years, preparing me for my US Navy career, where I practiced overseas, and I was deployed to Japan and Kosovo and Africa, but lived in Spain and in Japan. My final 1 year of training was at Stanford University Medical Center, where I specialized in pain management. Right now, my practice consists of regenerative medicine, not the traditional pain management that you may have heard of or experienced, but the way of the future and the way of now. Regenerative medicine is using your body's own cells to help affect areas of injury and areas of pain. We place those cells, all the anti-inflammatory proteins and all the growth factors, into the area of injury using an ultrasound or a C-shaped X-ray to precisely deliver those cells to exactly where they need to be to help with your pain and inflammation. The traditional pain management is utilizing steroids or radiofrequency ablation to affect your body's ability to handle pain. This is using your own cells, and they're anti-inflammatory, they're growth factors, they're stem cells, and they're going to the areas of injury and pain. We have regenerative pain management procedures for all different kinds of pain, including the spine. So if you have neck pain, back pain, hip pain, the regenerative medical therapies can be used to address those kinds of pain. And even within the spine, there are different kinds of pain, including that coming from the discs, that coming from the facet joints, and that coming from all of the ligaments and overlying muscles and soft tissues. If somebody's told you you need an epidural injection, we can do that. Only we're not going to use steroids. We're going to use your own body's growth factors and anti-inflammatory healing proteins to affect that change in your body. You may have also been told you need radiofrequency ablation or burning of the nerves in your neck or in your low back. I used to do that. I don't do that anymore because we have better alternatives. We can inject your own body's growth factors and healing factors, and we can not destroy the tissues, but rather we're trying to rebuild the tissues. Regenerative medicine can also be used for arthritic pain in our joints, such as the shoulder, the hips, and the knees. It can even be used in the small joints of the hands and the feet in an arthritic condition, or even after a surgery if there's still some residual pain. I love living and working in Phoenix. In my free time, I love to hike all over the valley and up in Sedona. I love to cook. I'm somewhat of a foodie myself, and I love gardening, as my husband and I take care of our yard, and we love all the beautiful cactus and succulents of the valley.